Ladies and gentlemen, members of the media in Tobago, and the rest of you in the media corps following us in Trinidad and Tobago, members of the national population following us home in Trinidad, and those of you following us abroad. Welcome to our weekend update, particularly focused on the report on our management of our COVID crisis. We are here in Scarborough, Tobago today. Rainy Scarborough, rainy Tobago, but we are fortunately indoors and dry. And I have with me this afternoon, coming all the way from Trinidad, the Minister of Health, Minister Terence Singh, and we have the local authority in Tobago on the management of our COVID crisis, the Secretary for Health, Mrs. Tracy Davison Celestin. So we have the central government and the Tobago House of Assembly here this afternoon and the local Tobago media. And I am advised that Secretary Davison has brought with her her corps of doctors, Dr. Wheeler, who has been with us every time we're here in Tobago, and maybe one or two other doctors. So without further ado, I'd like to pass the podium over to Secretary Davison Celestin, who would update the nation on Tobago's issues, and we hope to hear from the Tobago crew before I come back to you to introduce Minister Terence Singh.
And thank you very much, Prime Minister, and the pleasant...
Is that mic on?
Yeah. Thank you very much, Prime Minister. And the pleasant afternoon to the listening public and to our residents in particular. Firstly, I wish to move to acknowledging International Men's Day and International Children's Day, both celebrated on Thursday and Friday respectively. And so I want to indicate that it is critical to recognize that we need to reimagine our world and the roles in which we are now casted, especially in today's context. And so the mental well-being of men and children are, of course, paramount to our society. And sometimes we all take things for granted when we say, you know, that men can handle their own stories and children will bounce back. But to my mind, everyone needs a little TLC, even the super strong amongst us. So let us all make room for a little extra care for men and our children. Children also need to be allowed to express themselves, so let us all listen. Now I move on to Tobago's COVID-19, and to indicate that with planning, with preparation, and of course with public participation, we have managed to report no new cases on the island in the last 25 days. And so that means that there are also no active cases in COVID care for us. But I need to remind you, the members of the public, that this does not mean that we are COVID-free. It means no new cases have since emerged for testing, and our healthcare providers across the board have really pulled out the stops, and the public, by and large, has been actively following all of the protocols. I wish to use this opportunity to express thanks to all those who have been playing a very active role in keeping our people safe. And I want to encourage and to urge all of you to let us keep on working so that we can tackle this monster together. I also want to use this opportunity to indicate and to urge people to come forward for testing if they are presenting with symptoms. Don't do nothing. The best thing you can do for your loved ones is to, of course, get tested. It is safe. We are not COVID-free, and we must continue with safety and protection. I want to use this as a jumping-off point as well, because not having a tested positive case is not a license to flout our regulations. Please note our health inspectors, they are out and about. The police service is also doing its duty. And it is compulsory to keep all of us safe at this point in time. And it is not about one person, it's about the entire island, and more so, the entire country. And so we cannot falter in our fight until we know that the pandemic is over. and we have to learn to live with it at the end of the day. But I know that we are all fatigued and emotionally tired, and in many instances our wings have been clipped. But we want to spend time with our friends, and of course we want to socialize. We want to return to the normal. But this pandemic, it's claiming far too many lives, and we don't want it to be you. We need to be innovative, and apart from that, we need to be inventive in order to move our island forward. And so let us all take advantage of the opportunities to reset with the government funding, with the soft loans, with grants, with entrepreneurial initiatives, with digital paths, the side hustle, even skill-based training, business advice, and even business training. And there are facilities to enable you to move in the right direction. Right here in Tobago, amongst the divisions of finance and the economy, community development and enterprise and labor, health, wellness, and family development, the options are many. We are fatigued, sometimes a little bit complacent, and even a little lazy, but we don't want sometimes to fill out the forms and to pull together the bundle of documents. And sometimes we can be very slow in getting our business in order. But if we are to restart the process of moving the economy forward, our lives will even be able to move forward as well. With that said, I want to take this opportunity to introduce our primary care manager, who will shed some light in terms of where we are with our COVID statistics and influenza. And we have no other but Dr. Mitchell.
Good afternoon, everyone.
Good afternoon, Dr.
Good afternoon, sir. Good afternoon, Mr. Dialsi.
Good afternoon, Dr. Mitchell.
All right, thank you, Madam Secretary. Just to jump off on one of the points that she made with regard to the numbers that we're seeing in Tobago at present. We have not seen a COVID case on the island for the past 25 days. We attribute that to a very aggressive primary and secondary contact tracing effort. The Secretary mentioned that we did a lot of planning and a lot of preparation, and we are beginning to see the fruits of that. We have, over the past few months, monitored the mental, physical, and social well-being of all our clients under quarantine. We also have a very aggressive rapid containment with regard to any positive cases that we see. This has been done in conjunction with TEMS, Office of the CMOH, and the TTPS, and I would like to thank all of them for their response. We have seen an increase in mask wearing, and whereas we still have a significant number of persons who are not wearing their masks correctly, the numbers in general have gone up, and I would like to congratulate the public with regard to that effort. One of the things that we have noted, though, is that there is a reduction in the number of cases that are presenting with viral symptoms. This, however, should not lull us into complacency. With the drop in the number of viral cases, we're also seeing a reduction in the number of cases being swabbed. Again, not to be lulled into complacency, as the Secretary would have advised, persons who are symptomatic are asked to come forward to ensure that they are swabbed and that they're tested. It may not be COVID, but it may be something else that requires attention. You can be seen at any of our primary care enhanced facilities at Scarborough, Canaan, and Roxborough. You can also be seen at the Accident and Emergency Department. And if swabbing is also required beyond that, you can be seen at the Green Room, which is located up at the old Scarborough Hospital. With that, I would like to thank you, Madam Secretary.
And just to introduce Dr. Wheeler, Medical Chief of Staff.
Good afternoon, Mr. Prime Minister, and good afternoon all. I'd just like to briefly speak on further developments in testing in Tobago, where we have received our new antigen testing machine, and that machine will be commissioned on Monday, 23rd of November, and training will begin with 3 medical laboratory technicians who will be performing the antigen tests as part of a national verification exercise. The reason I mention this is that as we go forward in testing and monitoring the incidence of COVID, the antigen test, which intends to be part of this exercise, will also be done in Tobago, and we are just focusing on the verification exercise at the moment. Thank you.
And last but by no means least, one more, Dr. Tiffany Hoyt, County Medical Officer of Health.
Hi, good afternoon, everyone. All courtesies observed. So, well, I would like to take this opportunity to first and foremost thank all the members of the healthcare team of the Trinidad and Tobago Police Service and all our collaborating partners who have been working tirelessly to ensure that we have gotten to this point that we are at. I have to give a special shout out to my staff at the office of the CMOH, who I call my Spartans. Thank you all very, very much for all your hard work and dedication. I'd just like to note that thus far we have submitted 1,730 samples for testing. Of this, we had a total of 106 cases testing positive. And as Secretary has said, we have no cases currently active on the island. And I like to use the analogy to persons. Just like if you're trying to lose weight, you would diet and you would exercise. When you get to your goal weight, you don't go back to not exercising and eating badly. To maintain your gains, you have to continue doing what you did to get there. So please, let us maintain wearing our mask properly. Make sure your mask is covering your nose and your mouth. And wearing the mask doesn't mean that you're small up. Wearing the mask goes together with physical distancing. So let the tagline be, wear your mask and practice physical distancing, please. And please continue to observe all the measures such as hand washing, etc. And please, for persons, if you are ill, please don't go to work. Please don't go out in the public. Stay home, call our hotline, 800-HEAL, and you'll be counseled by a doctor and ensure you get tested. Thank you very much.
Thank you. Thank you very much, Secretary Davis and Celestine, for putting on your Tobago team with relatively good situation reporting to the country. I want to associate myself with the Tobago report today by saying that you can say what you want, but I'm in a particularly proud moment here today where I can identify 2/3 of the Tobago contingent as Dr. Wheeler and Dr. Mitchell as children who I knew from birth. Their parents were my associates, and I'm particularly proud today to see that they have grown up to have taken responsibility for Tobago in this pandemic. I don't know Dr. Hoyt that well, but I've known Dr. Mitchell from baby and Dr. Wheeler from, he wouldn't admit it, but you know, that's what it is. But that being the Tobago report, I think this is a good time for me to call on another major investment in the youth of Trinidad and Tobago who is standing up and taking responsibility for us in this pandemic, the Chief Medical Officer, Dr. Roshan Parasram, who is with us here in Tobago technologically. Dr. Parasram, you have the floor.
Thank you, Honorable Prime Minister, Honorable Minister of Health, Secretary for Health and Wellness, Tobago, my medical colleagues in Tobago, Dr. Hoyt, Dr. Wheeler, and Dr. Mitchell, members of the media, members of the viewing and listening public. So I will give the update as of Friday at 4 p.m., 20th of November. So this is the national update. In terms of total number of tests done thus far, we just have 35,749 tests done in the public sector. If you include the private sector tests, we are just over 60,000 in total. Of these, since the 12th of March, we have 6,261 of those being positive so far. The total recovered persons are 5,559, and the total active cases at this time in the country, 589. With regards to new positives over the last 24 hours, we would have had 28 persons testing positive in Trinidad over the last 24 hours. And our deaths as of 4 p.m. on Friday would have been 113 deaths so far. With regards to our total hospital patients, our load is significantly lower than it would have been for quite some time. We are actually having an overall occupancy of about 13% in our hospitals, and that accounts from various facilities giving us 44 cases in total. At the step-down facilities, again, we have a low occupancy, 28 persons at this time. In terms of our state quarantine, 166 persons, and our total persons in home isolation are 489. With regards to our hospital, as I said, 44 persons, they spread across a couple facilities. So Couva Hospital and Multi-Training Facility, there are 29 persons, 5 in the ICU, 1 in the high dependency unit. In terms of Cora, there are 14 persons, all ambulatory, all very stable. And there's 1 person in the St. Anne's Hospital who is in a stable condition as well. With regards to our step-down and transition facilities, at the Claxton Bay facility, we have 18 persons. At the UV Davie facility, there are 10 persons. So lastly, in terms of our facilities, our quarantine facilities, over the last 24 hours or so, there has been some discharge from those facilities. So the figures as of this morning are Paria Suites 55, Cape Park Hotel 21, Regent Star Hotel 17, and at the Cascadia Hotel 19 individuals. We expect a flight from Canada, I think later on today, but at present we have 112 persons in state or state supervised quarantine. When we look at, I just want to touch briefly on the epidemiological picture that we have been seeing over the last 2 weeks or so. So when we would have met 2 weeks ago, we would have spoken about a daily caseload of about 18 cases per day, which was very good at the time. This would have been on the week ending 16th of November, 2020. Between that weekend on the Friday to the 13th of November, we would have seen a slight increase of 22.1%, taking us from 18 per day to 22 per day. If we move on to yesterday, so our figure as of yesterday, if we remove the cases that we would have seen from the prisons, as you know, there's a significantly large cluster of individuals that we got as positive from the prisons in Trinidad. At present stands at 84 persons. So we remove that from the equation, we find that we would have had a daily average of about 37 cases per day over the last week. This is week ending on the 20th of November, giving us an increase of 68% from the week ending the 13th, and giving us an even more significant increase, almost close to 100% if you look at 2 weeks prior to that. So we are keeping a very close eye on the situation to ensure that the numbers remain in this region. There will be fluctuations as we go forward. We hope that the fluctuations continue to go downwards as were seeing before, and not upwards as we have noted over the last couple of weeks. But again, it requires, as Dr. Hoyt said, it requires us all to play our part, continue wearing our masks appropriately, and continuing doing the public health measures that we need to have us going in the right direction. Thank you, Prime Minister.
Thank you very much, Dr. Roshan Parasram, the Chief Medical Officer of Trinidad and Tobago. Before I go on to introduce the Minister to give us his perspective, could I ask Dr. Parasram to just give us a little touch on what Dr. Hines would have said to the team with respect to the statistics? Because if one hears these numbers in isolation, one can probably get the wrong impression. But there is a statistical yardstick which would cause us to react not just to the no case or the low numbers in the hospital, but the curves that we are working with. Dr. Parasram, please.
Yeah, so as we are looking at the epidemiological curves week on week, what I said, based on the discussion at the end, is that we are seeing a slight increase in the upward direction over the last 2 weeks. So it has become a little more acute over the last week or so, notably so, as I said, with a daily average of 37 And it is a cause for concern. It is a cause, as we have seen with COVID-19 in other parts of the world as well. You find that those small increases, we cannot ignore them. We have to pay particular attention to them. And we are doing so on a daily basis to ensure that the measures that we have put in place stay in place, one. And of course, we have to be mindful that COVID-19 is unrelenting, it's unforgiving in terms of the way it has progressed across the world. And any area that it gets to propagate itself, it will do so. Areas of people congregating without mask wearing, congregating without social distance, and we have found any little pocket that persons behave in that way, we are finding cases going upwards in those particular instances. We are seeing a situation where the clusters that we are seeing are really clusters, family and friends, close family and friends, clusters in workplaces where people have gatherings, where people feel a little more comfortable and are able to take off their masks. In those circumstances, you find that you're finding little clusters here, there, in different areas. Epidemiologically, we are concerned over the last week or so to see that increase. It is, in our view, significant from an epidemiological perspective, given what we have seen happening over the last couple of weeks. There's somewhat of a reversal in the pattern, and we have to be very mindful that in a very short space of time, 68% can go to 100%. And we could end up in a situation where we have 50 cases a day, 100 cases a day very quickly. So really, we have to keep a very close eye on it at this time, and the graphs tell the tale as well. We're seeing that small increase, but small in a graphical sense could mean a big change from a population perspective. Thank you, Frank.
Thank you very much. Thank you very much, Dr. Parasram. At this time, I would like to ask the Minister Terence Dale-Singh, who is responsible for this sector of the government, to give us his perspective on the management of a COVID crisis.
Thank you. I think the mics are dead.
Sure, these mics are on.
Go ahead. Yes, thank you, Honorable Prime Minister, my colleague, Secretary of Health, Wellness and Family Development, Secretary Tracy Davidson-Celestin, Dr. Hoyt, Dr. Mitchell, Dr. Wheeler, ladies and gentlemen of the media, citizens of Trinidad and Tobago. So, Prime Minister, I did not come all the way from Tobago to meet rain. I came to meet sunshine to bathe in the beach this evening. You have deceived me. So, because I'm staying overnight. Anyhow, the last time I was in Tobago would have been Saturday, the 21st of November. At that time, I would have alerted the country. At that time, there were 7 countries.
Are you sure that was the last time you went to Tobago?
October, sorry. The last time it was Saturday, 24th October. That was your birthday.
And how could I miss that?
Exactly. And here we are today, Saturday, 21st November. At that time, I would have alerted the country that there were 7 countries around the world that were seeing COVID-19 accumulated figures of 1 million and 1 million plus. A month later, that has grown to 11. So from 7 to 11 countries with 1 million cases and more in 1 month. Behind those now 11 countries are again 4 countries with caseloads of over 800,000. So when we come back here on the 21st of December, we don't want to hear now, there are now 11 and 4, 15 cases, 15 countries. But that is where the pandemic is evolving. The average number of cases per day continues to increase around the world. Is now 600,000 plus cases per day. That's the global picture. And we need to be cognizant of that. And deaths, unfortunately, continue to rise at an average of 10,000 deaths per day around the world. Ladies and gentlemen, I want to jump off on where the CMO just left off. Speaking about this, what could be perceived to be a small increase in the cases over the past 3 weeks. What we have to be worried about is what is behind that. because what you are seeing now is not necessarily what is to come. Typically, with these increases, the hospitalizations lag by about 2 weeks. Then the advent of people into the intensive care units and HDU units, as the doctors will tell you, might lag by about a week to 10 days, and then the deaths lag again. So the reason I am saying all of this is that we are entering into a festive season of Christmas. And we are urging people, and the ministry's messaging is going to start very soon, about what we should be doing at Christmas and not doing. I want to reach out with this platform to all chambers of commerce to ask their membership not to have Christmas parties. I have spoken to my own peers at the Ministry of Health. We'll be having no Christmas functions at the Ministry of Health. I want to reach out to all religious leaders, tell your flocks, your devotees, your jamaats, to avoid family gatherings this Christmas season. Every leader of an NGO, every member of parliament, all 41 members of parliament, everyone who has influence over people, to urge those who look up to you for leadership that this Christmas ought to be a holy Christmas, but a quiet Christmas. Keep your bubbles within yourself. Celebrate within your family units. Don't bring other 3 and 4 family units and friends into that bubble, because you are seeing that is what is causing the spread in some countries. So I am asking the national population to join with us to encourage people from abstaining from weddings, parties, Christmas parties. Just be safe for this Christmas. The last thing I would like to speak about, because it's important now, as there's talk about a COVID vaccine, we are now in the middle of administering our national seasonal flu vaccination drive. The numbers so far are not very encouraging, and I see Dr. Mitchell is agreeing with me. We were hoping that by now we will be giving out about 10,000 doses per week. We peaked in week 4 at 6,963. And every week from week 4 to this week, which is week 8, there has been a steady decline from 6,009, 5,003, 4,007, 4,006, and this week 3,116, giving us a cumulative total of 4,468. That is not a good report. By now, we should have been up to around 60,000, 70,000. Now, let me contextualize the flu vaccination drive with the anticipated COVID vaccination, which should come sometime in 2021. We would like at the Ministry of Health, and I want to join my Tobago colleagues, that we should end our flu vaccination administration drive by around March or April of next year. The reason being, we don't want the population to be confused when the COVID vaccine comes and you are given the flu vaccination at the same time. It is going to cause confusion in the minds of the population. So I am urging the population, let us get our flu vaccination numbers up. It is free, it is relatively painless, but it will really help save lives from people who are susceptible to flu. It will save our ICU and HDU spaces. And let us complete our flu vaccination drive by, I say, around February, March, for the latest April. So when the COVID vaccines reach sometime next year and we start that, there could be no confusion in the minds of people. Well, I got a vaccine last week. You're telling me to come for a vaccine this week. You know, what you all really doing? So it's just to alert the population, let's get this flu vaccination drive over and done with right now. So the 2 messages: 1, let's spend a very holy Christmas, but a very quiet Christmas. Don't invite people into your homes. If you receive an invitation to go paranging house to house, that is dangerous. If you receive an invitation to go to a wedding, an office party, that is dangerous. Let's spend a very quiet Christmas this year, so in 2021, all of us will be around, and we will celebrate 2021 with the full bells and whistles and parang and everything else. Thank you very much, Prime Minister.
Thank you very much, Minister Dayal Singh. I want at this stage to speak directly to all the people of Trinidad and Tobago. I want to let you know that your government, and in my case, your leader of government, leader of the country's business, I am one of almost 200 people in the world who has been called upon to carry out a specific assignment. That assignment is to take decisions to protect the population of the nation that we manage against a virus. How do I do that? I do that, as I told you from day one, way back in the early part of the year, that I will be relying very heavily, if not totally, on the advice and the guidance of the scientists who are in the health department with specialization in public health, in virology, and in epidemiology. I do not, at this time, intend to deviate from that commitment that I gave to you, because it is the only and the best approach to treating with the virus. However, what I've been doing over the months is to compare our response with comparator countries, particularly Commonwealth countries, where the laws are relatively the same, meaning that what can the government do to or with a population in trying to get a population to either cooperate or to respond or to associate with governmental decisions. And my staff and I have been monitoring, even as the pandemic wasn't with us from January or February, as it came to us, and as we all became like others, it was useful to see what other governments were doing, because we are all, as governments, as prime ministers and presidents and whatever, called upon to do the same thing, which is to respond to a virus which does not discriminate within race or political or geographical boundaries. This document is my working document, where I've been monitoring the response of 17 countries and 17 governments and many more countries in that way, to see how certain responses have been adopted by some countries, what the response has been, and in fact, where the jumping off points have been along the way. These comparator countries are countries who did nothing. There's a famous country that did virtually nothing. Others who, in doing nothing, identified the virus as being able to pass through without too much disruption. Those who did certain drastic things, those who did something in between. You, the people of Trinidad and Tobago, you would know what we have done. But whatever we have done, it was done deliberately against a certain background, and today, those actions have us in a position that in Trinidad and Tobago, you could have heard from the Secretary for Health in Tobago, which is a separate island in our nation, that at least this weekend, we could report that we do not have active persons who are known to be carrying the virus actively in Tobago. In Trinidad, you would have seen what we had done initially, drastic action we took. Then we saw a spike coming on, then we took some responses to that, partial shutdown and so on. What we have been doing, which most countries have not been able to do, is to be coming out and doing more and more and having more and more exposure. What this dossier tells me is that particularly those countries who were held up as examples of how to manage the virus without major disruption, who initially were thought to have got the best formula, where they had a low infection rate and they didn't disrupt the economy and they didn't bring hardship on their populations. Those countries initially, countries like Sweden, countries like Australia, countries like Iceland, countries and one or two European countries. What appeared to have been a shortcut, an easy way out, in recent month or month and a half, all those countries have been overrun by the virus, resulting in drastic actions having to be taken so as not to allow those countries to get to where the other countries had been when the virus had overrun them. I speak here about European countries, one or two South Asian countries, and in particular the United States, states in the United States. And I tell you this against the background that in Trinidad and Tobago, where we have held the line, and we are under advice from some people for good reason, encouraging us to be more open, more forthcoming to the economy, that if we are not careful, we too could end up in a situation where it appears as though we were doing well, and inside of a 14-day period, we could move from a report like the one we got from the Secretary for Health Tobago today to one where Tobago does not have enough healthcare infrastructure or personnel to deal with people in Tobago who require hospitalization inside of a 2-week period. And of course, the same thing, Dr. Parrish, I'm responsible for the whole country as Chief Medical Officer. We could find ourselves in Trinidad and Tobago inside of a 2-week period where we would have gone from a relatively comfortable situation where we think that we are doing things well enough, that we could now take greater liberties. And the reason why I could tell you that is because my dossier here showed me what has happened in other countries that were in our position, and inside a 14 to 28-day period, they've moved from comfort to calamity. And the calamity, as I want to mention again, is where people are infected. You have a high positive rate in your nation. So many people are infected, and of that population of infected people, a certain percentage requires hospitalization, and a certain percentage of that require high intensive care and possibly ICU care. And if the health sector is not able to deliver that, that is when you now join the rest of countries who park up refrigerated trucks outside of the morgue because the morgue is full. As Prime Minister of Trinidad and Tobago, I will do everything within my power to try to hold us away from that situation. And it brings me to the point of Tobago, our nation of Trinidad and Tobago. With Tobago's report today, I could say to the population, our policy is and has been to try to keep Tobago as protected as possible, because being a separate part of the population from Trinidad, it fell to us to utilize what we can to prevent Tobago from becoming super exposed. We did that by reducing the amount of persons that move from Trinidad to Tobago. Remember, we reduced the amount of flights to Tobago, we reduced the amount of persons on the ferry, and we asked people in Tobago to only travel if it is absolutely essential. That's how we sort of provided some element of protection within the nation for Tobago. But having done that, I could say to you, we are now in the Christmas season. Mid-November, we are in the Christmas season. You would have heard the minister say, we're talking about Christmas parties, and that the Ministry of Health has asked the private sector not to have Christmas parties. It is not that we don't want to celebrate Christmas. It is not that we are Ebenezer Scrooge and cousins of Scrooge. It is that the issue that we are facing and fighting is the issue of contact, issue of infection crossing from person to person through contact where there is congregation. Anything that brings about increased contact or congregation of the population, whether that contact or congregation is in a party, on a train, in a bus, or inside of the family, that contact is in fact the enemy. And that is why if you go through my dossier here, you will see a number of European countries as part of their instructions to the population, and in some cases enforced by law, families are not allowed to have family members coming to their households because the virus does not differentiate between uncle and tanti and nenen and grandchildren. It identifies human-to-human contact. And the advice in many countries is that the problem largely is growing because of familial contact, and they're advising families, stay isolated even away from your other members of your family. If you follow the international news in the United States, you would know this week coming up here is Thanksgiving. It is the weekend when all Americans go home like lemmings to where they came from. The Center for Disease Control in America is telling Americans, do not go home for Thanksgiving. If you want to save yourself and your grandparents and whoever else, if you love them by not going to see them. In short, do not travel for Thanksgiving weekend. Now imagine a country of 300 million people, which normally, like in China, for the Chinese New Year, they all go back home. Wherever they're from, they go home. The response to the virus in 2020 is the government telling people, or the authorities telling people, do not go home to your family. Of course, this will have serious economic effects for those who rely on the Thanksgiving traffic, on the Thanksgiving economy, on the Thanksgiving purchases, and so on. But they say, the turkey will be there next year. Don't go home to it this year. Because if you do, many of you will not be there to take part in next year's Thanksgiving when the turkey is available. Bring that to Tobago. It is my understanding that virtually every villa in Tobago is booked for Christmas. Meaning that a lot of Trinidadians have quite properly and expectedly chosen Tobago as the place to be in the Christmas holidays. That's a good thing. And we will do nothing to prevent that from happening because it is good for the Tobago economy, and it's good for Tobago people and for Trinidad people who choose, unfortunately, have Tobago to come to for Christmas. But as we do that, we cannot forget the underlying requirement to not ignore the instructions of the health department. That even as you are coming to Tobago, I'm told that we still have some thermal checks at the ports. If you're coming from the airport or you're coming from the seaport, the thermal checks will be in place. CAL is exploiting the possibility of finding a test which may or may not become available soon, where we can check at the port short notice, quick result testing. If it becomes available, we'll institute that. We are checking now to see if that's available to us. Because if we can isolate those who are going to Tobago or coming from Tobago by virtue of the fact that they're passing through 2 entry points, it will assist us in managing and retaining what we have at the moment. However, we expect that a lot of people will be in Tobago for the Christmas weekend, starting next week. It would not take very many instances of misconduct to convert the Tobago report from the one you got today to the one where Tobago is highly infected, because it's a small population in a small space, and if the virus is not controlled in the way it ought to be controlled, if it gets out of hand in Tobago, the same report you got today within 3 weeks, 2 to 3 weeks, could easily be the opposite. It all has to do with the behavior of people coming to Tobago or who are in Tobago. Do not for 1 minute believe that because you've heard about a vaccine, that we no longer need to be stringent. Now more than ever, we need to hold the line in Trinidad and Tobago, that when the vaccine becomes available, we will be vaccinating people on a fairly good foundation. We don't want by mid-2021 to be in a crisis situation and the vaccine is not going to roll back the crisis. Don't have that impression that, okay, we can do what we want, and if we get sick, a vaccine is going to come to get us back. No, Dr. Wheeler can explain to you, it doesn't go so. We want to be virus-free. So when we get a vaccine to apply to the population, you're applying it to a population that is on a fairly sound footing, and that would be the best place to be. And because of what we know about the incubation period of the virus, as we move into Christmas now, I mentioned to the population earlier on that my hope and my target and my yardstick of measurement is whether by mid-January we could be in a position to say that the next thing that we can do in moving in the direction we have been going, in opening up and taking a little more risk as we go forward in that direction, is to allow some of our children to go back to school. That would be completely out of hand and out of order if during the Christmas period in Trinidad and Tobago we free up, and that free up of the Christmas period causes us to disregard the scientific understanding that it doesn't matter whether it's Christmas or Carnival or New Year's or Easter. If we congregate, if we create too much contact, if we do not wear our mask, if we do not do our social distancing, if we don't sanitize, because Christmas is a period of congregation. The same way the Americans are telling their population now, don't go home for Thanksgiving. I'm not saying to anybody in this country, don't go home for Christmas. But I'm saying as you acknowledge Christmas as a time of family, as a time of community, remember this is a time of a pandemic. And if we're not careful, the Christmas cultural responses could, if we are irresponsible, put us in a position where the January numbers could say to us, no school, because we have in fact behaved badly, and the infection rate is so high that we can't even think about bringing children back out to school. That would mean that our children would have been out of school for almost a year? Almost a year. So if you want to play your part, as you must, not only for you, but for the next generation, the children who are not going to school, have a responsible Christmas. Do not encourage congregation and mixing over the Christmas season. I know it's a big ask. It's a big ask. But it is better to feel deprived of the Christmas festivities than to end up in the early part of January 2021 to be told that our nation has moved from where we are today, one which is not being locked down by family, not being locked down in totality, but one that has been holding the line and doing what had to be done and getting a fairly good result, as against one that felt that we're tired. We've been doing this for too long. I know it is easy to come to that thought, but you can imagine, as leader of the cabinet, with the pressure that we're under to do this, do that, do this, do that, for all good reasons, and not being able to do it, because our objective is to ensure that we are not in the worst possible position. Nothing is perfect. But you compare Trinidad and Tobago with the 50 countries mentioned in this dossier in mid-November. And whether you like us or you like yourself, you will come to the conclusion that Trinidad and Tobago is in a relatively good position. The last time I spoke to you, not last weekend, the time before, India, a population of 1 billion people, was being looked at as a country that had literally done very well handling the virus in a particular way. And there were those who were saying, well, the Indian model in a large and moving and vibrant population seems to have been. In the last 3 weeks, it has changed completely. The situation has changed completely. Malaysia, another Commonwealth country, using the same kinds of laws that we're using here. There are parts of Malaysia now, there are 2 provinces in Malaysia which are now in serious difficulty. In the United Kingdom, where they had moved to a semi-open but conscious of the dangers of the virus, England, Scotland, and Wales are now having far more restrictive conditions than we have here in Trinidad and Tobago. In the United States, which is familiar to most of us, many of us have family members in different parts of the United States. The absence of hospital beds in very many cities, especially small cities, is now a crisis. And the infection rate, the explosion, is beyond comprehension. We are not out of that wood. If we do not hold the line, we too will end up in that situation. Let me repeat that. If the government of Trinidad and Tobago does not hold the line alongside the cooperating people of Trinidad and Tobago, in the pandemic of 2020 November, we too will end up in the same situation of those countries which today had been thought to have been doing well, to have had governments that have done well, to have had decisions that evaded the disruptions, only to find out that there are very few things that are different between Malaysia, Australia, and our Caribbean neighbors, the United States, and all the countries of Europe. In short, there's nothing special about Trinidad and Tobago. We are just as exposed to the virus and to the results of the virus on a human population as any other country. So if you read or you listen and you see any country in a difficulty with the virus, you just say there, but for the grace of God, go Trinidad and Tobago. Because there's no difference. The virus does not give a pass to your race, to your color, even your geographical location. The only difference that we have among countries today is what we are prepared to do to get an upper hand or a controlling position on an infection which covers the globe. As head of the government, I will join the minister who spoke to the private sector. I will instruct the head of the public service on Monday to instruct the ministries of government departments and through the Ministry of Finance, the Office of the Corporation Soul, to instruct state enterprises that as part of our virus control response, that there is to be no state-sponsored or any Christmas party in the public sector in 2020. No Christmas partying, because partying before Christmas was out and Christmas partying is partying. There was one particular church in which there was a leader in the United States early in the pandemic who encouraged persons to come to his church on the grounds that his faith was so great that the virus will not, he said from the pulpit that the virus has no power in the house of God, and encouraged people to come to the church. Within the fortnight, he was dead from COVID-19. So while we acknowledge the birth of Christ and have been doing so for centuries, in 2020, let us do it without partying. And therefore, there is to be no Christmas celebration in the public sector. This, I know, will have an effect on the economies of those who support the Christmas partying, the parent groups, and those who supply the drinks and the food and so on. I know that. But what this is about is to prevent people from congregating and being infected over the Christmas season, which will threaten us in January and virtually guarantee that we will not be in a position to consider any opening of schools in mid-January. Having said that, we know that there are people who will be personally affected by this. Today, there are people expecting us to open bars further because bars are open. Bars are open to sell as much beer and rum as they wish. What is not open is bars being allowed to invite people to congregate inside of bars. Let me repeat that. Bars are open in Trinidad and Tobago to sell as much alcohol as possible. There's no restriction on the sale and consumption of alcohol in this country, whether from a bar, from a restaurant, from, well, the restaurants, you put a restriction because they service indoors, but from a supermarket or anywhere else. What is on restriction is the invitation to people to come and congregate indoors at bars over alcohol. That is a restriction. And unfortunately, we will maintain that restriction because that congregation is the danger. However, we understand what is being said by those who are affected this way. Since their business is a business of encouraging congregation through the line, and we are restricting them to protect all of us, we need to bear a little of the burden that they are bearing. And therefore, I have asked the Minister of Finance to find an additional $10 million specifically to treat with employees who work in bars and restaurants and who have lost their jobs or who have suffered a reduction of their income. For the owners of bars and therefore, and even restaurants who have lost or are losing their business, I would ask them to identify themselves to the monies that we have made available for small business support and to access the generous small business support which is available to sustain their business going forward, and the government will ensure that the applications are treated with some element of alacrity. However, I want to say to my fellow citizens of Trinidad and Tobago, the land of the smart man and the smart woman, when we offered salary grants through NIB for employed persons who lost their jobs, to get a salary grant relief, you had to have had a job to get a salary. And when you lost that salary, the salary grant was going to kick in. What we discovered, not surprisingly, was that there were approximately 5,000 persons who dishonestly sought to get money through the salary grant arrangement, and a not insignificant number of persons who tried to get rent relief grants. These dishonest people, who are part and parcel of our population, by being dishonest in this way, forced us to have to slow the process down to determine who actually qualifies and who didn't qualify. And that caused those who qualify to have got their grants later, or in some instances not to get it at all, because the rush from those who didn't qualify. So having said what I just said there about bars and restaurant staff who would have lost their jobs because of the lengthy closure of that aspect of the business, we will not just be handing out a check to you because you come and say so. It will be examined to ensure that those who qualify get it and those who don't qualify don't get it. And as I said, to the owners of the business, there's some element of relief available to you. For those who are suffering additional hardship, we have a Ministry of Social Development and Family Services. We have allocations to that ministry. And that ministry will treat with applications for persons who are not applying in the context of the loss of job, but plain and simple can't make ends meet. Either because they were self-employed in all kinds of entrepreneurial business which do not now exist, and even though there were citizens making their way on their own, because of the changed circumstances in the country where they were making that way, living on the margin, those margins have receded from them. And there are a number of them who are today facing some element of destitution. I've asked the Minister of Finance to find an additional $20 million for the Social Services Department, who will treat with such persons, who will identify themselves to such offices, and as per examination, when it is determined that they are to be beneficiaries of that, after examination, especially where children are involved, that the departments, the public service departments, would be relatively generous between now and January, specifically with an additional $20 million, specifically to deal with persons who were self-employed and whose self-employment have atrophied as a result of how we are living today. For example, a person who would have been a vendor at a sports event and who would have walked around the city preparing certain things and having income only at events, or a person who might have been doing something which now is not part of our activity. And I want to say something to public servants, because I am not skeptical, I am very skeptical as public servants treat with screening. I know that some public servants are not as empathetic as they should be when people come to you and tell you, I need help. I don't ask you here to break the law or to be loose-fisted. I simply ask you, public servants who would be responsible for disbursing these assistance programs, to be empathetic to the people who come to you. You might make a mistake here or there, and the smart man or the smart woman might get away. But it's better if the smart man or my smart woman get away than for children to go hungry in our population. And if we ever catch up with the smart man or the smart woman, hand them over to the police, please. And that is an instruction from the Prime Minister of Trinidad and Tobago. Wherever there are clear instances of dishonesty, such persons should be prosecuted to the full length of the law, because I do not want our children somewhere within our border to go hungry, because the public servants have been so careful to keep out the smart man or the smart woman that children have gone hungry because the screen has screened them out. Those of us who are relatively comfortable, just remember that when you feed yourself, there might be 1 or 2 families in this country who do not know where the next meal is coming from. And that is not a Trinidad and Tobago thing. Yesterday, in my monitoring of other people's circumstances, I saw where 34 million people in the United States have fallen below the poverty line in recent times. 34 million people in the richest country in the world. So this is not a Trinidad and Tobago thing. It is something that all governments have to deal with. I mentioned to you a while ago Malaysia, where in the state of Sabah, in the province, the level of poverty and destitution as brought about by the COVID management has been horrendous. We in Trinidad and Tobago, we are not in that situation, but we have our own difficulty. And what I'm trying to do here is, in a managed way, trying to reach out to those who are affected. It is not logistically easy. Had we been a digitalized country, it would have been easy to know whose number turns up anywhere. Unfortunately, we are not yet in a position of the unique identifier. So it is difficult to manage and manipulate the data. But hopefully, if we're ever in this situation again, God forbid, we should be in a position to know who is who and who is not who, because our infrastructure would have allowed that. Among the changes we'll make this weekend, very small changes, we will allow food services in casinos. That had slipped through the crack in the last fortnight. We've allowed it in cinemas. It should have been cinemas and casinos, but we'd allow that. And of course, we met on Friday to discuss our management of the congregation and what changes we will make. And on Friday, before Saturday, must have been what, Friday night? Yeah. We agreed that there was no good reason in the context of what we are doing to not have ourselves exposed through certain activities. There was no good reason to continue to prevent hunters from hunting. And therefore, we took a decision to allow hunters to hunt again. Not that we're extending the hunting season. It will close as normal, but we would have prevented hunting for about 6 weeks. And tomorrow, on Monday, the responsible Minister of Agriculture will take the necessary steps to have the registration of hunters done normally, so that by the end of the next weekend, hunters could be allowed to hunt. And I say that in detail because I want those who have come this morning on Facebook with all kind of dotishness about the Minister of Health. Our decision has nothing to do with you, because as Prime Minister, I will not be swayed by any such behavior. Our decisions are made against serious analysis, and the decision to allow hunters to go back out was done on Friday, and I will instruct the Minister on Monday, and it will take a few days for the hunting permits to be issued and so on, and hopefully by weekend, hunters go out, so that people have 8 weeks of hunting. It is not an extension of the hunting season. The hunting season ends at a particular date early next year. I think it's end of February. And the law is there, and that law remains in place. I want to say that CAL has made certain proposals to the government, which the CMO would examine, and the Ministry of Health. And that proposal is to use an early result testing program, which is relatively acceptable in some quarters, to allow us to have an increased level of transportation that would have benefits for Tobago and CAL's opportunities elsewhere. And hopefully, here in Tobago, you may see that test coming on stream. The Minister of Health will make the outcome of these examinations available to you as to whether we'll be able to do tests other than the PCR tests that are being used now. And for Christmas, I want to once again say to you that what happens in 2021 will be determined by our behavior over Christmas. At this stage, I want to ask my staff to show you an officer in Toronto, Canada, responding to their threats of the virus currently, so you can see how some people in a Commonwealth country close to us is responding. Could we get the officer from Toronto?
Our top priority has always been the health and well-being of all Ontarians. Despite the range of public health measures and restrictions that have been in place since early October, we've seen the situation continue to worsen in regions across the province, particularly in hotspots like Peel and Toronto. It's clear more needs to be done to limit community transmission of COVID-19 so that we can keep our schools open, safeguard our health system capacity, and protect our most vulnerable. As we've seen around the world, lockdowns are a difficult but necessary step to prevent COVID-19 outbreaks and bend the curve in the number of new cases. Based on the recent data, and to protect the health and well-being of people and families in these communities, Peel Public Health and Toronto Public Health will be moving to lockdown effective Monday, November 23rd at 12:01 a.m. Measures under lockdown include no indoor private gatherings will be permitted with anyone outside your household. Individuals who live alone may have close contact with one other household. Outdoor gatherings will be limited to a maximum of 10 people. Retail stores providing non-essential services in shopping malls can operate through pickup or delivery. Non-essential storefront retail can stay open for curbside pickup or delivery only. Restaurants must close indoor dining, but may stay open for takeout and delivery. Religious services and weddings will be restricted to 10 people indoors and 10 people outdoors. Gyms, sports facilities, cinemas, casinos, museums, and personal services must close. Manufacturing, agriculture, supply chain, and most construction can continue. These measures are being put in place to prioritize the essential services we rely on.
Thank you very much, members of the staff here in Tobago and my staff from Trinidad. I played that clip so that you can understand and compare what we are experiencing here in Trinidad and Tobago and what others are experiencing and what their governments are doing in response. Because, you know, there are some people amongst us who would like you to believe that you are suffering as a result of the stupidity of the government of Trinidad and Tobago and the uncaring nature of the Prime Minister himself. I hope you were able to glean from that Ontario, Canada response, which comes into effect on November 23rd, which is when?
November the 23rd.
Monday.
Monday.
So that comes into effect on Monday in Toronto, Canada, where a lot of our citizens live, none of whom could tell you that they are better off there than they are in Trinidad and Tobago. We, as I started off by saying, all governmental leaders have a responsibility to respond to a virus, the same virus, whether it is in Turkey, in Ireland, in Australia, or Toronto, this is what we are called upon to do. And you in Trinidad and Tobago can rest assured that as Prime Minister of Trinidad and Tobago, notwithstanding the advice that I may get from others, I will do everything possible to give the population of Trinidad and Tobago the best chance to avoid a deterioration of our circumstance. Thank you very much, and we'll take your questions now. If you don't have any questions, that's quite all right, but I see Liz getting to the microphone. Go ahead, Liz. I will take the questions one by one, please.
No problem, Prime Minister. Thank you so much. And good afternoon to you and your team and to everyone. One of my first questions is, I know you did not speak anything about in terms of the borders. Many are asking about the borders being reopened, and also nationals who have companions who are non-nationals returning to Trinidad and Tobago. Any word on this?
Okay, let me take the last part first. In the context of the borders remaining closed, the borders are closed, but we are operating an exemption process to allow persons to come over the border, going out or coming in. But strictly speaking, our borders are closed and movement only on exemptions being granted. Persons who are to come into our country, we said that we are managing that on a case-by-case basis. Largely, though not exclusively, to citizens of Trinidad and Tobago. If we say exclusively to citizens of Trinidad and Tobago, then we couldn't have allowed the Chinese ambassador in. Understood? But it is mainly for citizens of Trinidad and Tobago. But in that narrow window of persons who are not citizens but who need to be here, because we are managing the entry on a case-by-case basis, when an application is made by a person who is not a citizen, a decision will be made as to whether an exemption should be granted. So an exemption would have been granted to ambassadors who are coming in. And of course, if there is a father whose wife and children are in Trinidad and Tobago, but he is not a citizen of Trinidad and Tobago, the ministry will consider that and make a decision. And more than likely, we expect that it will be granted so the family could be reunited. So that is how that is handled, on a case-by-case basis. And the first part of the question about whether the borders are going to be open, let me go back to the 330,000 people who are outside of Trinidad and Tobago who live out there, because I think we've dealt with those persons who were caught outside, who had traveled temporarily and were caught when we closed the borders. Those persons would have been up to the applications up to August. We took it to mean that if you were caught outside in March when we closed the border and you had not applied to come back home by August, then you really were not coming back home. But by August 31st, all those persons, or the majority of persons who were caught outside by the sudden border closure and who wanted to come back home, we would have allowed them back in on a phased basis, and we brought back home approximately 5,000 persons. However, that 330,000 people, the majority of whom live in the United States, about 275,000 of them, in that population, many of them want to come home, one of whom is my own daughter, who haven't been home since last January, thereabouts. Those persons are also required to apply to come in. And we don't just open the border and let them in, for the simple reason that the United States is now one of the most highly infected countries in the world. Not just New York, not just Florida, but across the United States. Unfortunately, that is so. We can't do anything about that. But if we open it and they come home by the thousands, the very system that we have put in place, which is the parallel health system, will collapse. Because in that population of likely persons who could come in infected, when that population joins us here in Trinidad and Tobago, if we get spikes generated by that, and we end up with people who need health care beyond the capacity that we put in place to treat with people who would need high-intensity health care, that is when we're going to fall down. So we are saying, yes, there are certain screens put in place that persons wanting to come home should get a PCR test within 72 hours, only to discover that many of them can't get that test. A PCR test within 72 hours is not available in many instances. And the other test, the fast test, is in many cases not the standard we want, but we are now discovering that it may be possible. Cal and the CMO office, there's another test that we can probably use, which persons abroad can get to allow them to be screened on the way in. And we also said a fortnight ago when I met you that we do know that very many people would want to come home for Christmas, and we'll want to allow as many people to come as possible. So we got a protocol in place where if you got the test, can get in, and you want to go into the state quarantine, because we have to maintain quarantine. If we don't maintain quarantine, then everything that we've done since March would fall apart. So when you come in, you will have to go into quarantine. The state quarantine, which is free, and the numbers we manage. And if you don't want to go into the state quarantine and you are prepared to accept your exemption and pay for quarantine in designated hotels, that is under state supervision, that is also available, and that will allow a larger number of persons to come home for Christmas. But whoever comes in, there's a 6-day element of quarantine. Yes. And we, you would have heard last time we said on the 6th day you'll be tested, and if by the 7th day your test is negative, you can go home for Christmas. But if you want to come home for Christmas, you got to travel at least a week before Christmas, otherwise you'll spend Christmas in quarantine. So these protocols are in place, and our doctors here in Tobago and in Trinidad, and our daily or every other day report will keep managing this. CAL is also linked in its operations with the ministry that is granting the exemption. So once you get your exemption and you turn up at the airport with your test, whether it's a PCR or otherwise, then you come home to Trinidad and Tobago. And once you get here, you have a 6-day quarantine. And on the 7th day you're negative, you can go home and remain with your family. And even when you do that, we ask you to remain family focused and not party and so on. So that's the general scene for Trinidad and Tobago.
I don't know if you could look into the matter in light of the Minister of National Security not being here. A flight was expected from Canada, and some nationals who were supposed to board this flight on Wednesday, they were turned back. Even though they had their PCR test, the airline would have told them something different. I don't know if you're aware of that.
I couldn't speak to that because I don't have that information. I'm totally unaware of that, but I couldn't see if they were carrying exemptions and they had their PCR test that was not older than 72 hours, I really am to be advised as to why they would have been denied access.
Yes. Okay. I know you spoke about the behavior of citizens during the Christmas towards the reopening of schools in January. Is it that you're waiting to see officially the results in terms of health, COVID-19? You're waiting to see the results after Christmas into January before making an announcement about the reopening of schools?
Absolutely. When we live through the Christmas, it will begin to show itself in the statistical expressions within a few days after New Year's and going into, in that 14-day period, by mid-January. So if we're thinking about opening school by sometime during December, we will set a date for, and it's not the whole school population, it would be a certain cohort we'll start with. And when we put that date in place, it will be controlled by what the data is post New Year's Day. Because look at it this way, it would make no sense for us to have protected our people for almost a year, and then we end up with a huge spike in January, and then say, okay, we can let them out. It's the same virus. If the condition is bad, we will not be able to put children out there. But if it is reasonable and I would say usable, we are monitoring it on a daily basis. We are looking at the statistical aspect of it, because the funny thing about this is that you have to look at the statistical curves. I must say I was very pleased I did not miss my statistics class when I was in Mona. I didn't like it at all when I was forced to do statistics. But when I sit down with Dr. Hines and look at the numbers, I understand regression curves and I understand the steepness of a curve on a projection today and where it's going to be. And for the public, the doubling of our numbers on a 7-day cycle is what will give you an idea as to where we're going. If you're seeing us doubling the numbers in a short period of time, then we're in big trouble. If we are doubling the numbers over a longer period of time, then that gives us a little more comfort. But of course, you can project where you're going to be ahead of time based on where your curve is now. So if when we finish our Christmasing and our New Year'sing, depending on what numbers we get during the first week of January, which is the early part of the incubation period for that behavioral period, then we would know if the opening of school could be effected as promised sometime in early December.
Just 2 other questions before hopefully I get the mic again. In terms of the anti-gang legislation and the opposition abstaining.
Let's finish the COVID thing first before we go to the anti-gang.
All right. So moving along, in terms of churches and weddings, is it that churches remain 1 hour, weddings remain 20?
No, we give an extra half an hour. Churches are 90 minutes now.
Yeah.
Okay.
Church services are 90 minutes, and that will apply.
Some are asking for even more time to pray and worship.
I told you about the preacher who said that nobody in God's house would get sick, and he died within a fortnight. That remains intact.
I don't know if you can also look at a situation where I would have received a call from a fisherman today who stated that...
No, Liz, don't tell me fish getting COVID.
No.
Oh, okay.
No. Okay, so I received a call from a fisherman today who stated that 2 persons were stranded out at sea at this time in terms of in Tobago, off Castara. But they stated that when they called the Coast Guard said that there were no patrol boats available. I don't know if you can look into that.
Well, I'm sure that the Minister of National Security is following us. He's following this program, and he would have heard that, and he would get to it immediately. I don't know what the circumstances are, but if people are out there and need help, help should be available from the Coast Guard somewhere, either from Scarborough or from patrols who are out at sea. Yes.
Good afternoon, George.
Mr. Leacock.
Radio Tambrin. Prime Minister, you said partying and Christmasing. I have another thing for you.
Which one is that?
Campaigning. THA election.
Thank you for mentioning that.
Notice nobody mentioned whether the minister will be putting in place special protocols, so how this campaign would take place to keep us safe over the Christmas period. So that's my first.
Well, let me answer that one time. Campaigning is one kind of activity that could cause congregation of people. And because there's an election here, it's due sometime in the early part of the new year, it would behoove all of us to campaign differently. Yes, there'll be campaigning, but nothing that involves the congregation of people should be encouraged. And I'm sure that there are aspects of campaigning that could be had which does not allow congregation of people. It is not the campaigning that is the problem. It is not the political party name that is the problem. The problem is bringing people together in large numbers. Don't do that. Okay?
Okay. Prime Minister, there's also a Road to Recovery Committee. And a lot of the debate and the questions we've been having in sessions like this have to do with when this is going to open and when this is going to open. Is the Road to Recovery Committee active? And is it possible maybe to assuage some of those fears by having a sort of conditional reopening kind of position? So you gave an example of that where you said, if everything goes well for Christmas, maybe we can open schools in January. Is it possible to broaden that kind of presentation of information? So at least particularly for business, you have some little bit of something to work with going forward.
Well, George, if we look at what restrictions exist, you really would find that in Trinidad and Tobago, the range of restrictions is very narrow. It's the closed border on which there are exemptions. It is the closure of schools to protect our younger population. And it is restriction on the full operations of bars and restaurants. Oh, and of course, there's a restriction of persons visiting geriatric homes. Outside of that, there are very few restrictions in Trinidad and Tobago, you know. We have not said that if you have a business, you can only sell pots and pans on Friday, or you can only operate the business on Monday. The business community is open. Remember, after the shutdown, we opened up by allowing construction to begin. There's no restriction on construction. Factories are open. I myself toured a number of factories at the opening to indicate, let's go back to work. So there isn't a real yoke, but the economy is affected by the general confidence levels and the participation of persons in certain aspects of the economy. But the actual number of restrictions, for example, if you listen to some people who are in the recreation business, you would think we've closed bars. If you listen to some other people, you figure we've shut down. The food supply system is completely open and encouraged. So there isn't much more that we can do at this time if we are to still be responsible and keeping our eye on the possibility of a quick turnaround of our circumstance. The public service was in on part-time and rotational. The full public service is out to work now. So Trinidad and Tobago, we are in a position which very many countries are not, which is our restrictions are limited. If we were able to open the border, we would be relatively close to normalcy. Okay?
And sometimes I'm surprised as well why most of the questions you've been getting are related to the restrictions. But can we really have a real reopening? For example, I estimate that we get about 20 flights a day from the United States during normal times. And if the United States continues to be how it is, then even if we open, there's nobody to come. So it leads to my next question. Have we been able to pull from anywhere any modicum of hope for a tourism revival that would happen in the next 12 months or so? Or is there an alternate source? When we planted cocoa a long time, we used to plant immortel trees for shade in between. Is there a shade tree that we could find outside of deficit spending in the Tobago scenario to sort of shepherd us through the next 3 months? Assistance to hotels, for example, does not necessarily get passed on to employees.
Well, it is our analysis that Tobago is fortunate in that there's a Trinidad. There are lots of people in Trinidad who are housebound and want somewhere to go. And because of the international circumstance, Tobago is their first outlet. And in fact, we expect to see an uptick in Tobago visitor arrival for local tourism. And all I could say to Tobagonians is be prepared to receive visitors. Our new ferry is due here into operation. The first of 2 new ferries would be here into operation hopefully before the end of the year. And the second one would be due probably within a month of that. When those 2 ferries get here, our analysis is that there would be much more traffic between Trinidad and Tobago. As I told you a while ago, checking last week, we discovered that those people who offer villa tourism in Tobago, we're having a good response, and we expect that as we go into comfort zone, providing that there isn't an outbreak and a spike in Tobago that causes Tobago to become another hotspot, then Tobago's potential for the tourism business. And people going to the reef, and once people are in Tobago, then they will want to go to the restaurants, they will want to use the bars without congregating and so on. And that's how it's going to grow. There is no other avenue we could see other than if the vaccine becomes available, as people from our source areas become more comfortable having been vaccinated. But there's another problem. In those areas, especially in the Americas, there is going to be a lot of people who will not want to be vaccinated for all kinds of reasons. Eh? And that shouldn't be news to us. We, from this part, we going to Europe, we have to go with a green card that shows that we have been vaccinated with, Dr. Wheeler can tell us what it is, yellow fever, diphtheria, whatever it is. So that vaccination card for COVID is going to allow certain people to come here or not come here. So the history has been there of that. But if you look at the response of the stock market, you will see that mention of the successful tests and the vaccines have had a tremendous lift immediately. It is because people are anticipating that once populations begin to be vaccinated, our Western populations in particular, that then people will feel safe to travel again. There are many people now who wouldn't go on a plane because they're afraid of what kind of environment the onboard would be. But we also saw where the MAX has been given clearance to fly. These are all considerations. But we believe that if you want to know my personal view from what I've been doing going forward, by the end of 2021, which is, what, 13 months from now, looking at the science that's in front of us, it is possible that we could be in a completely different situation by end of 2021. The assessment is that by that time, if the vaccination program starts by April going forward, and in the United States, there's some view that it could start as early as February or even December. Once that is successful and becoming more and more successful in numbers going forward, it will change the circumstance. Because before the successful report of the vaccine, we had no horizon of the end of the virus rampage. What the vaccine reports have done is to give us an idea that there could be an upper hand within 9 to 12 months. So that's the best we can do at the moment.
All right, then I wouldn't want the minister to come and spend 2 days in Tobago and not do some work, so I have 2 questions for him.
George.
And one, I have heard some fear from people. I myself cut my finger the other day and I decided to treat it myself rather than to go to the hospital or health center, because that's a center where people may be being tested for COVID. Have you considered, particularly in Tobago where we have so many health centers, doing the flu vaccine at totally separate facilities from the one where the COVID testing and that kind of thing is being done? So it would eliminate that fear that people say, I'm going there for a particular service and I might get something else. That's one. And two, is there an operational plan for the distribution of the vaccine? And not a strategic plan, an operational plan for the distribution of the vaccine if one becomes available.
Okay, so
I think Dr. Mitchell
Roxanne
is
will
in a
take
good position
the
to
first
answer
question, and I will take the second one, the
Okay.
operational plan.
And I could go away.
All right, good afternoon again, everyone. With regard to the flu vaccine, we have 17 health centers on the island. The flu vaccine is available at all 17. So if your concerns are going to one of the facilities where we will be testing or swabbing actually for COVID, you do have 14 other facilities with which you can access the flu vaccine. All right, keep in mind that not all health centers will be giving the flu vaccines every day, if only because we have the 10-dose vial, and you will have to call in advance to ensure that we are giving on a particular day, but you can get your shots. And I will use this as a plug to encourage persons to please come get your flu vaccines. We have been going out and our uptake is low thus far. We have places where when we go, we'd probably get about a 25% uptake. Now we're down to less than 10. If you do not want to access the vaccine at the health centers, as an organization, you can also call us and we'll make arrangements to come to you and to deliver the vaccines then. Thank you.
What better service can you ask for and get than an offer to come to you to give you a flu vaccine? That's the level of health care that the people of Trinidad and Tobago get, and of course we take it for granted.
Okay. So George, let me answer your question about the operational side of the potential COVID vaccine, right? So let me echo what the Honorable Prime Minister said. First of all, the news of a possible COVID-19 vaccine, no vaccine has been cleared by either the FDA or WHO as we speak, right? Vaccines are going towards the FDA on December 10th for emergency use authorization, which will allow it to be used in the United States. Good. Having said that, what we don't want to happen is that for people to hear, and the Prime Minister said this, that you have a vaccine and you think you are safe. Until you are vaccinated and enough people are vaccinated, you have to continue wearing your mask, social distancing and all that. Right. Operational plan. We are setting up 3 sites over Trinidad and Tobago to store the vaccines. The THA has already, I spoke to Dr. Mitchell already. They have a potential site, I believe. We are going to use the Couva Hospital as the main warehousing space and a backup site at C40. The constraints we are working with now, 1, we do not know the expiry date of the vaccine as yet. That means you don't know how much to order. We don't know, as Roxanne said, the size of the vial. Is it a 1-dose vial? Is it a multi-dose vial? We don't know those things as yet. But we are planning those 3 sites. I engaged the Trinidad and Tobago Medical Association over a month ago in anticipation of a vaccine. And coincidentally, Dr. Darren Dukiram is here, who is the president of the Trinidad and Tobago Medical Association, not the Medical Council. So don't ask him questions about you know what. He is the Medical Association, because we recognize that in the Ministry of Health, we may need extra capacity in case we have high demand for the COVID-19 distribution. So we are working on a distribution plan, gauging both the public sector and the Trinidad and Tobago Medical Association through Dr. Darren Dukiram to bring more bodies on board, more sites outside of the typical healthcare center which you spoke about. So that is the beginnings of the operational plan that I've been discussing with the TTMA since about a month or 6 weeks ago. Okay?
It is my intention to involve our uniformed personnel. I'm talking here specifically about the Defense Force and the Coast Guard personnel to assist in reaching persons who require to be reached, but who would not normally be part of the health care delivery system. So we're going to use all the resources that we have available once we have the vaccine in hand.
Good evening to the panel. Question to Dr. Rowley. Dr. Rowley, how do you respond to people who may have slipped through the cracks since the start of this pandemic? There are a vast majority of people who have still not been able to access any of the various government relief initiatives. I spoke to a couple of people who have been affected from the hotel sector in particular, but there's one person in particular who has had the good fortune of having relatives who are relatively well off and are able to assist him with utilities, groceries, that sort of thing. But there are still many people who, for whatever reason, bureaucratic or otherwise, in terms of accessing the grants, still have not been getting them. How do you respond to those people?
Well, the first thing is that the grants were survival contributions. Let's put it that way. Secondly, we put certain protocols in place for qualification for the grants. I would not know what is the reason why a particular person would not have. But if those persons were in the hotel industry as employees, then what was in place for such person was that they would have been noticed by the list provided by their employer, which should have been on record at NIB, because NIB was asked to provide a grant to persons who would have lost their jobs. If the employer was somehow not on record or some similar kind of situation, then complexities could have applied. I know of complexities where persons have turned up and say, I've been working at so-and-so place and I've lost my job, but then there's no record of that employer at NIB. And therefore the NIB support could not have been available because the NIB would not have any notice of that person. Such a person would then have had to go to the social support department, because the Ministry of Social Services deal with those persons who were not in situations because of having lost their job. So we had two lines of support. If you've lost your job, and by losing your job and claiming the grant, there ought to be a connection between you and an employer, and the NIB would have be dealing with that. On the other hand, if you were just simply on hard times and determined to qualify by virtue of a claim for social support in the Ministry of Social Services and Social Development and Family Services, then your application will go there. I would have also seen where some persons who were claiming not to have been serviced, it turned out that they were making their applications in the wrong place. And then, of course, they would have had to go. But we try to make it quite clear. There are two lines of applications. If you had a job and you lost your job, then that application would have been made not to the Ministry of Family Services and Social Development, but to the NIB, who was handling it for the government. And the Ministry of Finance had provided over, at last figure I know it was over $100 million to NIB to do that. Some people would have been disadvantaged because their applications would have been complicated because of where they worked. Because if this person that you're referring to was in fact working, let's say, a hotel or a guest house, and they're asking for a grant because the place had closed down or they were sent home, and they couldn't get a grant, I don't know the application form, but it may be that there are issues about the employment record. Okay? If what I've said there didn't cover the whole thing, there could be situations where the bureaucracy has not reached them for whatever reason, or there's suspicion in the analysis that the person may not really be entitled. That these are possibilities. I told you there were 5,000 people who were deemed to be attempting to double dip. And some of these double dippers are the ones who are talking most loudly about not getting a grant. Right? I'm not saying that all who there would have been some. I'm not surprised to hear that, but I think they should still stay in contact with the relevant department, and I expect that, as I said earlier, that the public servants who handle this would not only be gatekeepers, but be empathetic gatekeepers. But where there are clear contradictions of non-qualification, I don't think that you can ask the public servants to dispense monies where it is clear that the person doesn't qualify.
Good evening, everyone. Lois Vincent, Guardian Media. Dr. Rowley, I don't know if you made an error earlier when you were referring to restaurants. Just for clarity, is drinking allowed for in-house restaurants?
No, I did make the error, but I thought I had corrected it. Restaurants are not allowed to serve alcohol because they are allowing indoor dining. I know exactly what I had said, and you're right, I did make the error, but I thought I had corrected it at the time. Thank you for raising it again.
Okay. I know you said you have your dossier. with regard to the region, how have the other Caribbean countries been able to manage COVID-19 with respect to the reopening of schools?
The school population in most of our Caribbean territories have been away from, normal operations. There are some operations, but face-to-face schooling is not back to normal yet in any Caribbean country as far as I'm aware.
Okay, there have been concerns over the safety of the COVID-19 vaccine from quarters which consider themselves anti-vaxxers. Is the Ministry of Health going to evaluate whichever vaccine becomes available, or are we just going to adapt to the first one?
Let me ask Dr. Parasham to respond to that first before coming from the Minister of Health of Trinidad and Tobago. Dr. Parasham, could you come in on that, please?
Yeah, sure, Prime Minister. So any vaccine, and I know Minister will elaborate in terms of the COVAX facility, but any vaccine that we utilize in Trinidad and Tobago is sanctioned by the World Health Organization as well as the Pan American Health Organization. What those organizations have is a TAG group, which is a technical advisory group for vaccines, and any vaccine that is used worldwide can be given a stamp of approval before any of their member states uses those vaccines. So all the vaccines that we currently use outside of COVID have been approved by WHO and PAHO, and we expect no less for the COVID-19 vaccine by way of the technical advisory group. There are also regional groups, and Trinidad and Tobago has a technical advisory group chaired by myself, which looks at vaccines on the whole, and we'll be looking at COVID as well, in addition to our virologists. I don't know if Minister wants to add in terms of the COVAX facility.
That's it, yeah.
Minister, could you mention to the population what we have done in anticipation of a vaccine becoming available at some time as part of our pandemic response?
Thank you. Thank you, Prime Minister. So Trinidad and Tobago signed on to the COVAX facility. The COVAX facility is a facility that is managed by something called the ACT Accelerator. Three bodies: CEPI, which is the Coalition for Epidemiological Preparedness and Innovation; Gavi, which is the Global Alliance for Vaccines; and WHO. Under this facility, member countries like Trinidad and Tobago, which is a full member, the Prime Minister would have signed off on the last piece of documentation last week, Friday. We have already paid in 1.477 million US dollars into that facility. How it works is that member countries pay in a certain percentage into the facility. That initial down payment goes towards research and development. Research and development is the highest contributor cost of production of any new drug. So with that facility, we are guaranteed now, based on the principle of equity, based on the principle that it is better than many people in all countries get vaccinated than all people in one country get vaccinated. That is the equity part of it. So we are guaranteed in the first instance enough vaccines to cover 20% of our population. That will go initially to all frontline workers, inclusive of healthcare workers, sanitation workers, Defense Force, Army, Coast Guard, local government, CPEP, any worker in direct contact with the population, frontline. Then you start to vaccinate simultaneously all persons, hopefully over 60, especially those with what we call comorbidities like diabetes, hypertension, because almost 95% of our deaths are in that age group. Then you simultaneously vaccinate people who have challenges with their immune system. So people with cancer, people who are obese, people with lupus, even people with asthma. You vaccinate those regardless of age. Once you get through that in phase 1, then you start to vaccinate in decreasing order of importance, starting to dip into the general population like yourself. So that is how we are going to work it, and that is based on WHO's principle and Gavi's principle of equitable distribution of vaccine. And let me repeat, It is based on the fact that it is better to vaccinate many people in many countries than everybody in one country. Okay? Thank you.
CARFA has introduced a travel safety app and stamp and the CMO spoke highly of the app at when it was launched. Do we intend to incorporate or promote this same app within our existing framework for fighting COVID-19?
CMO?
Right, so what the app and the stamp does, so the app basically allows travelers coming into any of our hotels in the region, not only in Trinidad and Tobago, to one, allow for real-time uploading of any signs and symptoms that they may have of any viral illness, fever, runny nose, whatever you may have. You upload that through the THP app, which then goes to the office of the CMO of any country in CARICOM that is part of the initiative. The Tourism and Health Program stamp is a stamp that is applied to the actual hotel, given again by CARFA, but it ensures that a certain level of public health security is given and attendance to care by that particular hotel before they are given the stamp of approval. I believe that program was launched on the 5th of November, and some of the hotels in Trinidad and Tobago, as well as other CARICOM countries, have already signed up for that initiative. Once they are given the stamp, again, we can feel more comfortable actually staying in those places, and with the app, we can actually record illnesses very quickly. So it will go a long way in our surveillance aspect as it relates to COVID-19 and other communicable diseases.
Mr. Prime Minister, just in case you may have forgotten, I've been asked to ask, so please don't shoot the messenger. At the last meeting, you promised to review full allowance for all contact sports based on the fact that you allow the national teams to go ahead. Just in case you forgot, I don't know.
No, I didn't forget, but I'm glad you mentioned it. We did review it, but in the context of managing the amount of contact in the population, we decided that it was better if we had held off on that for a little while longer, because, you know, once we lift that, a very large number of people would immediately come out and start interacting at close quarters. We did say, and if I'm going to tell a bit of tale out of school, that sometime in the not too distant future, if there is a steadying of our curve, then that is the next area that we could probably consider bringing a little more risk in, because remember, it is a risk management thing. When we brought the whole public service back out, it was a lot of people that came out at one time, and we had to wait to see what the outcome of that would have been. And as we keep adding more people, the number of people out improves the opportunity for more contact improves the opportunity for infection, and so on. So that group of people that you mentioned, as a matter of fact, I got a plea this morning from a fitness enthusiast who tells me that the population is becoming unhealthy and becoming obese and so on, and therefore there's a downside to it. I agree with all of that. And but the thing is, if we are managing the exposure, that is one area that we've held off for the time being. Hopefully in the not too distant future, we should be able to, providing that we don't see an upsurge in our infections.
Okay.
PM, Lois, before you go to your next question, PM, there's an area of movement that has gone largely unnoticed, and I want the population to understand this. At the last press conference, we gave, myself, the minister, the authority to have all post-secondary students who cannot do online classes, who need to come out and do practical classes, to come out. I have given exemptions to thousands of students to come back out, and that has gone unnoticed. But that is another cohort of thousands of people on the move, going to all sorts of post-secondary classes, lab work, in medical field, university, the private schools for engineering labs. So even though they did not make noise, we recognize that if we don't allow that to happen, You're going to have thousands of people next year who don't qualify in their chosen field of study. And that is a tremendous amount of people, again, on the move. Okay?
Okay, so businesses have been calling for parameters so they themselves could set like triggers to be set for introducing restrictions so they can be a little more predictability. Dr. Hines already explained that it's a complex system that the ministry uses. How would the Prime Minister advise businesses to monitor the situation so they can expect restrictions, more restrictions?
The most I can say to that is that the responsibility for the population's well-being ultimately lies with the government. And one, notwithstanding what businesses will say, there's a certain element of bias and self-interest that is involved there. And while we are happy that they too have some contribution to make in ensuring that they do not encourage spread of the virus, ultimately, having taken into account what their interest is and the national interest, we can't leave it up to them to make that decision. Because I tell you, when things go well, they'll be out front taking responsibility. But if things don't go well, you know what's going to happen. And so it's the wider public interest that has to determine what is public interest in this matter.
Last question to Minister Dialsing. We've had cases in Tobago where business persons have turned away persons wearing the face shield. They are saying that it's not recognized and you have to wear a mask to be served.
Yeah, okay. So, yeah, that is a common issue. The regulations provide for any face covering, and it is defined as a mask, a face shield, or anything else. I had a talk, and I always talk with the Attorney General on these matters, and I did. The same way any private enterprise could have a sign up saying no short sleeves, no short pants, no slippers to refuse entry, a private business can ask you to wear a mask. I went to a pharmacy in Trinidad recently, and I will name it Superfarm. I went in with my face shield. The guard stopped me very politely. He said, "Minister, the company's rules are you must wear a mask." I complied. I went back in my car, got a mask, came back in. So the same way a business place can say no short pants, no sleeveless, no that, they can say you must wear a mask, and I confirmed that with the AG.
Okay, that's it.
Okay, thank you very much. And I think that brings us, Liz, you have another question?
Yes.
One more?
One more, okay.
Well, leave the book now.
This is my favorite book, and I can't leave the book alone, Mr. Prime Minister. The same question that you told me to wait until after COVID, in terms of the anti-gang bill. What is your view in terms of the opposition abstaining?
My view is very simple. Elections matter. If there are people in this country who elect people to the parliament to represent them, and those people decide that there are some reasons why persons under the purview of the police, persons who are likely to be charged for gang activity, persons who have been charged, persons who are answering for gang activity, that such persons should not continue to be in that jeopardy, and that some other reason supersedes that, then that is what the country is. Unfortunately, the group that I lead, the government, we did not have the votes to continue that law. There are other people in the parliament who believe that the law is not necessary. We disagree very strongly, and that is the outcome. The law says that it requires a certain number of parliamentarians saying that it should be. And of course, you know, we were put in that situation that when the law first came into being, this sunset clause, meaning that the law would only last for a certain period of time, and the law was enforced for that period of time. During that period of time, the problem of gangs did not go away. The problem was still there. So putting a sunset clause was not really arguable. We continued, but it means you have to come to the parliament whenever the sun sets on the law. And unfortunately, yesterday, the parliamentarians were required to give the law life going forward. And 19 members of parliament said that it was not sufficiently important for that law to be continued.
Okay, just one final question. I know in terms of where this press conference is being held, your entourage would have passed by what was previously the Tobago Correctional Facility when you were coming in on your left. What is your view, and I'm sure you heard about the protest action by residents of Glen Road, that some members of the Tobago House of Assembly were unaware of central government installing this Tobago Correctional Facility here, and in terms of Tobago's autonomy?
That was a situation where there was some communication complications. There will always be situations where central government and the Tobago House of Assembly authorities, especially when the communication is not clear. However, it was an emergency requiring a temporary situation, and decisions were taken that this temporary thing will be developed. It is not a hard, and there's no wall between the THA and central government. Tobago's business will always have a requirement for communication with the central government and vice versa. And where the communication, sometimes the public servants who do these things may at the time be overwhelmed by the exigency, the urgency and so on, and not be, like in my case as Prime Minister, I am always very circumspect that I don't want to mash any corn in Tobago, because I know the THA, the first thing that they will say, first thing they will do is to look for somebody to blame. That's the first thing. And the second thing they will do is to put me in my place and say we have our autonomy. And I experienced that. So I know that everything I do always has to be done in the context of what Tobago's position is if the matter is in Tobago. Unfortunately, not all public servants are sufficiently enamored with that fear, but at the end of the day, all's well that ends well.
Very quickly, Prime Minister.
And this is our last question, George. Thank you.
The moratorium on offered by banks on loans and so on is about expiring, has expired for some persons, and they're starting to get the normal bank response. Does the government have a lever to push the banks in a particular direction as far as this is concerned? And really quick, could you ask the Minister of Education to also include some physical activity in the at-home schooling for children? Because it seems as though a lot of children are just sitting in front of the thing and they're not even going outside of the house. Just as an addition at the end.
Okay, I certainly will. I expect that the Minister is listening. If not, I will indicate to the Minister your request for some physically hands up, out, down in front of the computer. With respect to the banks, all I can say to that now is that first and foremost, banks have customers. And without customers, banks have no business. So I would expect that the Minister of Finance, in his communication with the banking community, would raise that, whether there is room and appetite for extensions. I today don't know that they have taken that decision, but I'm sure that the banking community will look at the banking needs of their client population, and I would exhort them to do whatever they could do to ensure that the client population of each bank is given whatever relief. The government did what the government could have done very early. One of the first things we did in the COVID response was to treat with the banking system, and hopefully everyone involved in that aspect and other aspects will remember that we are in a pandemic and the outcome of that is multifaceted. So finally, I want to thank three groups of people today. Once again, I want to sincerely thank all our healthcare givers who have stayed the course, from pre-January to now and would have wonderfully well tilled the soil in Trinidad and Tobago to have allowed us to be in our current situation. It's not perfect, it's not final, but it's a lot better than many people with more resources than we have. And we thankfully have not suffered the kinds of outcome that could have been suffered had we gone down a different route. So thanks to the healthcare givers, everybody around the healthcare system. I also want to thank the people in the security system who have worked side by side with the healthcare department and managing all aspects of national security, which was an integral part of the country's response, whether it is the exemptions, the securing of quarantine, the handling of infected persons, and so on. These people have been on the job, and at the national level, we've done well there. And thirdly, not lastly, but I think it's a good time to acknowledge, not grudgingly, but to acknowledge that our media in Trinidad and Tobago have been very, very upfront and useful in informing the population at every step of the way. Since the epidemic started in Asia, these reports, then it became a pandemic, and the response of the government of Trinidad and Tobago in communicating with the population, even querying the actions of government, as a nation, we have done well. And I want to thank these three groups of people to have held our nation to where we are today, and we look forward to a good Christmas season, a safe Christmas season. You will hear us again before we get to Christmas, but we acknowledge that the Christmas season starts next week. With the end of November, we're getting into what would have been the Christmas parties and so on, in the offices and so on, but we're into the Christmas season. Let us hold the line for a little bit longer and be responsible. Each one look out for the other one. And we hope that we will enter 2021 with all of us alive and well, with a prospect that 2021 would be much better than 2020 was. Thank you very much.